Hello and welcome to this introductory training to cleaning validation. The FDA, Food and Drug Administration, create and enforce the law in USA. They have the Code of Federal Regulations Title 21, which is a rule which is reserved for the rules of the FDA. The three parts of this I would like to recommend to read for cleaning validation related to today's systems and processes are Part 11, Part 210 and 211. Two guidelines I would relate to are the FDA guideline for inspectors from 1993 and the FDA's from 2011 process validation guideline. EMEA, the European Medicines Agency, has its own law by the name of EUDRELIX. This comprises of 10 volumes, 2 which are specific for human use and veterinary use, and the other 8 are guidelines. I refer to Volume 3 and Volume 4, where Annex 15 can be found. In Volume 3, there's a lot of guidelines from the ICH. These are harmonized between Europe, Japan, and US, therefore used worldwide. The guidelines provided by them can be seen in this list, and these are really what you should get used to using in whatever discipline you are working with in validation. All of these listed here are relevant for cleaning validation. Volume 4, Good Manufacturing Practice, is broken up into these 3 parts, and I highlight here from Part 3 the health-based exposure limits and the guidelines for risk assessment. These are 2 very important documents that you should really look into. The health-based exposure settings guidelines focuses on a lot of different areas. These are all listed here. I recommend you get to know these, and without being an expert, it's good to have a basic knowledge of these. ICH-Q9, the guideline for risk assessment, points out a lot of risk assessment tools. These are listed here as well, and many more of them. For more source of information on laws or regulatory trends, please look at these homepages. There's a lot more, but these are the 6 I use generally. Thank you very much for your time. I hope you enjoy it. Please share with anyone else you know that you think it could be relevant. Bye-bye.